times get hard, and we're here to help at NorthPoint.
Hello, and welcome to another episode of NorthPoint Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. And we want to provide you with practical tips and resources that you can use. Today's episode is about diabetic care, a condition that affects millions and disproportionately impacts marginalized communities. I want to share a few statistics with y'all. Did you know that over 37 million Americans live with diabetes? That's 1 out of every 10 persons. Nearly 90% of those cases are type 2 diabetics, which is largely preventable with the right care and lifestyle changes. And diabetes is the 7th leading cause of death in the U.S., contributing to complications like kidney disease, vision loss, and cardiovascular issues. So I was very excited to have my guest on the show today talking about this because I am actually a type 2 diabetic. Mm-hmm. And this is just a very important topic for our community. Mm-hmm. So today we're going to really talk about what diabetic care looks like in underserved communities, barriers to access, cultural challenges, and strategies for supporting prevention and management. I am excited to introduce to you, we're being joined today by our NorthPoint Certified Diabetes Nurse Practitioner, Michele Kimber. Michele has a deep experience working with patients managing diabetes in settings with limited resources. So just to share a little bit about this, now you've been, you're a board certified diabetic educator for 15 years. Mm-hmm. Okay. And you've been at NorthPoint for over 24 years? Yes. Okay, that's a long time. And you have 3 daughters. Mm-hmm. Okay. You're a former Northsider?
Yeah.
Yes, and you love to travel. Where's one of your top travel place that you've been to?
Aruba.
Aruba. I love Aruba. I've been there too. I love Aruba. And then I understand that you love to cook. You cook African food, Caribbean food. I'm looking around the studio. I don't see any beans. I don't see any plantains. So okay, we're gonna let you off this time.
Next time I'll bring some.
Yes. Well, thank you for being on the program. Mm-hmm. Would you share a little bit about yourself and how you came to be a registered nurse and in your journey to NorthPoint, how you came to be with us?
Hello, Lisa and Jason. Thank you so much for having me today. My name is Michele Kimber. Yes. Something about me is I have been living in Minneapolis for many years, and I love to cook, as Lisa said earlier, and I love to travel. Mm-hmm. I became a registered nurse because I like helping. I like being a helping hand to people. Mm-hmm. Mm-hmm. What led me to NorthPoint, I saw an opportunity where I could give back to the community. Mm-hmm.
Yes, giving back, that's so important.
Very important.
Yes. Mm-hmm. And then, so how did you get into diabetes education though? Because that's not where you started.
No,
correct?
No.
Tell us about that.
A driving force for me to become a certified diabetes educator is I saw that there's a need in our community. Mm-hmm. In our community, we serve population who are higher risk to develop diabetes. Mm-hmm. And being a CDES allow me to be a better resources for our community. My focus is building a healthier community among the diverse population that we serve.
Mm-hmm. Okay, wonderful. So tell us about your work. Myself as a diabetic, we're talking to our community. We want them to understand if they were to come and work with you, what would their expectations be? What do you do? Who's eligible for your services? And how do patients get connected with you, Michele?
Mm-hmm. As a certified diabetes educator, I provide education and resources to patients with non-prediabetes, type 1 diabetes, type 2 diabetes, and gestational diabetes. Continuous glucose monitor placement, education and instruction, teaching patients on how to self-monitor in their blood sugar, insulin teaching, and helping pregnant women on how to stay within blood glucose ranges during pregnancy.
Okay.
My role as a diabetes educator is to guide, equip people to discover healthy solutions and motivate for change and achieving a positive result. Also, the goal of being a diabetes educator is to empower people in making lasting positive lifestyle changes. I can see anyone with the diagnosis previously mentioned. The way to get connected to these services is to schedule an appointment with your doctor. If you are in need of a doctor, give us a call. We can help you find a doctor to see. The number is 612-543-2500. Also, any established patient at NorthPoint can be referred by their PCP, your primary care provider, can also make an appointment with the Diabetic Self-Management Education Program team.
Okay.
The Diabetes Self-Management Education team was set in place to better patient care. The overall purpose of this program is to capture newly diagnosed individuals with diabetes. The qualifying candidates include type 1, type 2, gestational diabetics. Over time, I have seen the effectiveness of the program, whether the A1C improvement and better control. The Diabetes Self-Management Education Program provides several members of our team, including not limited, the CDE, registered dietitian, and providers support.
Wow,
Thank
that's
you.
a lot.
Yeah.
Oh my goodness. So if you're someone like myself who's type 2 or type 1 or like you said gestational diabetes, this is the place to come because you're going to get that type of support that you need.
Definitely.
Now, I know I want to ask you, would you clarify for our listeners, because some people don't know, what is the difference between type 1 and type 2 diabetes?
Type 1 diabetes, you might need insulin for the rest of your life. Okay, you need insulin definitely. If you don't take your insulin, you're gonna get sick for sure.
Yes.
You know. And type 2 diabetes, we can do diet, exercise, and also your oral medication. But I have a lot of things to talk about insulin.
Sure.
So we'll keep that for the next question.
Sounds good. Okay. I know that for myself, just to share a little bit about my personal journey as a diabetic, I grew up in a household with a diabetic. My dad was a type 2. My grandmother was a type 2, aunts and uncles. And so when I first received my diagnosis, I was... it really freaked me out, to be honest. And I think there are others in our community that when they find out, you know, that they have diabetes, it can be discouraging for them. And it can feel like, you know, frightening because you don't know what's going to happen. You don't know how to manage it. What do you do with your patients? What kind of support do you provide them when they've been diagnosed and they get referred to you, Michele?
The first question I ask patients is how they feel about the diagnosis. Are there challenges, barriers they are facing? It is very important to meet patients where they're at and offer what they need. For example, what goal would you like to work on? You know, based on the patient readiness to learn, determine the next step for the patient.
Okay. Wow, that's a really good approach.
Yeah.
And we do. That's one of our pillars here is whole person integrated care. So I love that you're focused on the patient and asking them, what is your goal?
Yes,
Could it, because it could be lowering their A1C, it could be
exercise, could be
you know,
food,
exactly,
different
coming up
things.
with that balance between all of those things, which is difficult. It's hard, you know, maintaining. You're working, you've got kids, you know, all of those things. And but we know that it is preventable with lifestyle changes. Yes, which is amazing. What do you, what would you say, actually, tell me if you can share any techniques for helping patients stay motivated. Because this is a journey, right?
Building a rapport, making sure patient trust me is the key.
Okay.
Trust is very
so
important.
that rapport with you and
Yes.
building trust is the key
is the
to
key.
their. Okay.
Some technique I would like to use are making a follow-up phone calls, asking patient how they are doing,
Okay.
and how they are adjusting to the new recommendation they received my last encounter with them or my last visit with them. Another technique I like to use is making sure they're involved with the care.
Okay.
You have to be involved with your care. You know, I ask my patient, "What are your goals for a healthier you?" Okay, we want to be healthy.
Okay.
You know, that's the goal.
Sure.
Instead of just instructing them what to do. Finally, I recommend the patient to follow up with their regular primary care in 3 to 6 months to ensure that they meet their goal. For example, checking the A1C, you know, and then sometimes the doctor have other testing that they want to repeat, like your microalbumin, your creatine, just
Sure,
those kind of
all of
stuff,
those
all
levels.
those lab values.
And then, do you help them make choices about if their physicians recommend like continuous glucose monitoring? That's one of the things that I have. Are you able to help them with that? Because that sometimes feels overwhelming too. How do you stay in touch? You know, do you do the traditional finger prick? Do you do the continuous glucose monitor? You can help them learn about that?
Yeah, sure.
Okay.
The newest technology we use is I have provided them a handout.
Okay.
Okay. And I will walk through the instruction and the education with them and use the teaching method to self-demonstration back to me. Okay. Because that's important.
Sure.
You don't want them to leave without getting that piece.
Okay.
That's very important, that demonstration. We do not educate on insulin pump, but we do offer a referral to see your provider or to see the endocrinologist,
Okay.
or we outsource it to HCMC, Hennepin County Medical Center.
Okay. Okay. And then we also have other supports like we have licensed dietitian. Do you
Yes.
do you do referrals
Yes.
like that as well?
Yes.
Okay.
We do have a diabetic team, the diabetic self-management education team. You will see the dietitian, you'll see myself, and then also you'll see the primary care provider.
Okay.
So it's
Okay.
every Tuesdays and every Thursdays. It's a
Oh.
very nice package.
Wow.
I want everyone to try that.
Okay, wonderful.
Yes.
All right, I may have to come see you, Michelle.
Definitely,
My
please do,
my
Lisa.
A1C is a little elevated right now, so I think I need
I'll be
to
able
get
to get
in.
you back into
Yes.
the right track.
So now you mentioned you're going to talk to us about insulin therapy because there's some misconceptions about that.
Yes,
Will you
definitely.
share a little?
Some mistake I have seen include patients making their own medication adjustment, like increasing the dose of medication earlier than they were directed by their medication instruction. For example, some mistake I have seen are patients not adjusting up the dose after a period of time. The patient was given the instruction to start Ozempic 0.25 milligram weekly for 4 weeks.
Right.
Week 5 increased to 0.5 milligram.
Okay, yep.
And so forth and so on, 1 milligram dosage
Sure.
and so forth. Sometimes patients may be confused about the instruction,
Right.
but they choose not to call the pharmacy or the triage nurse or the primary care provider for assistance in making the medication adjustment. So it results in making an increase in medication at the wrong time,
I see.
and an increase of medication wrong dose,
Okay.
because they're not sure what they need to do to move forward.
Right,
Okay,
right.
instead of calling. Additional mistake includes sometimes patients do not plan for upcoming vacation or trip to ensure that the medication supply will be enough to the length of time staying away from
Okay.
the Twin City.
Okay, and I'm going to talk about my husband right now because we went on a cruise and he did not have enough of his diabetic medication, and they would not give it to him. They gave him like a small dose at the pharmacy on the ship.
Okay. Oh, that was nice.
And then when we got off, we were scrambling around. So that is a very important thing, is to make sure you're planning,
Yes.
for that
Yes.
time
Definitely.
frame. Okay, and do you think people do that because you have to keep your insulin refrigerated?
Yes, but when you have a visit with me,
Yeah.
I do go. If I always ask if you're traveling,
Okay.
and I talk to the patient about what they need to carry.
Okay.
We'll have a whole spiel that we put out for
about
that,
what they
about
do.
what they
Okay,
need
so
to
just
do.
quick, let me ask you. So
Yes.
let's say I'm going somewhere and my hotel room doesn't have a refrigerator, and I'm a diabetic and I
Okay.
need to take my insulin. What would you tell them?
Okay, I'll tell
Just
them
curious.
that we have a little pouch that they can buy Walgreens, Walmart, or even Amazon. They can call and then, they can order it.
Okay.
And then they'll ship it to them within however time that they want it to ship them to
Okay,
it.
and-
And then they can carry that with them.
And the pouch has like a.
It's like a refrigerated type of pouch.
I did
It
not know
doesn't- Yeah,
that.
they
I
do.
did not know
Oh,
that.
really? Oh, okay.
See?
Yeah.
I'm going to sign up for your
that.
class. Yes.
Please do.
Yes.
Okay, and then just 1 second.
Yes.
And then some of the common mistake. It's inability to take medication as directed.
Yes.
The patient, they forgot to call for refill or resulting in not taking the medication because they don't have a refill.
Right.
The refill is not available right now. Okay. And also patients sometimes feel better or have little or no symptom, so they stop taking the medication
Oh, yeah.
earlier than instructed.
Yeah.
And sometimes they misuse medication supply, like forgetting to prime or dial the insulin medication pen to the accurate or appropriate dosage.
Okay, yeah.
Because sometimes people forget to do that.
Okay.
Sometimes patient also they forget to test their blood sugar.
Okay.
That's important
Yes,
to do.
that is
know?
important.
Because you have to decide. Sometimes you have to decide: is your dose supposed to be 10 milligram? 10 units. And it's depending on what type of medication that you are on.
Sure.
And then also this is usually done by calling before you go out of town, by calling before you go on vacation to
Okay.
get your refill
Okay.
in place. Don't wait the day of.
Sure.
At least 10
Right.
days, or go to the triage nurse.
Sure.
It will be done by the triage nurse as well.
Okay.
Sometimes patients are instructed to take their medication at specific time of the day. Usually, this is the best use of medication to treat the condition.
Okay.
For example, short-acting insulin, Novolog, Humalog.
Yeah.
People always have that mixed up.
Okay.
They'll take it after they eat. It's supposed to be taken 5 to
before.
15 minutes before the meals.
Okay.
So that's
okay.
one of the
Okay.
things that always coming up.
So all of those things are important because I'm actually guilty of that too. Sometimes I forget to take my Ozempic
Okay.
at a certain time.
certain
And so
time.
you're saying that's important to have that
Yes,
consistency
it is.
when you're
It
a
is very
diabetic
important
is
to have
taking
a
the same
consistency.
day
Yes.
of the week,
Yes.
same time.
If
Okay.
you remember the same
Okay.
time, but for
Okay.
sure, same day of the week for sure.
Okay.
Uh-huh.
And we have some other things that we want to talk about, but I want to ask you, what about the cravings? I'm going off topic now a little bit because I know as a diabetic, I got a little bit of a sweet tooth.
Okay.
And so what would you say to our listeners and myself about
Well,
the sweets?
Have a piece of fruit.
Okay, look, I got my apple right here. Instead of eating candy.
Instead of having candy.
Yeah, Jason just gave me some caramels for my birthday.
Oh,
He was
caramels,
naughty.
okay.
But
So
if you're
what
going to
you do
eat
is-
sweets,
if
yes.
you're gonna eat
Okay.
anything sweet,
Okay.
is have a piece of fruit or
Okay.
have some berries. The berries are very low
Okay, in sugar.
in sugar,
Okay.
in carbohydrates, I should say. Half of a cup of berries.
Okay.
That's all you need, and then the sweet tooth will go away.
It'll go away. It's going to go away by itself. I don't know. I don't know about that now.
Strawberries
Yes.
are very good.
Okay.
Blueberries
Okay.
are the best.
But
So,
the berries are the best.
berries are the best.
Okay.
They're low in carbohydrates.
Okay. All right. That's good to
stick
know.
with
And
that.
you
your
talked.
strawberries, your blueberries.
Okay, and you
raspberry,
talk
if
to
like
your patients about that. What is the best type of fruits?
fruits,
Okay, instead
yeah.
of dried fruits,
Yeah.
you want
Yes,
whole
fresh
fresh
fruits.
I see. Okay, that's good to
And
know.
also, we do have a food shelf here, so please use it.
That's right. Look, there we have some
Yep.
great produce in our
very great
food
produce,
shelf.
yeah.
Yes.
You can go on and pick up whatever you need.
All right,
So,
that's good to know.
I
So
love the food
that
shelf,
leads
so
us
please
into
use that.
talking about our. I'm busy. I'm on the go.
Yes,
Right. I
yes.
start early in the mornings and I go until late at night. We live busy lifestyles now. So what can you tell us about your busy person and incorporating diabetic management in your busy routine? What are some top tips for you?
Diabetes management in a busy routine involves planning your day. Planning, yes,
Okay.
that's important.
Okay.
Following your meal plan. Monitor your portion. Not because you're out
Yeah.
that you're just gonna eat whatever. Monitor your portion.
Okay.
eat half of your food and take the other half home with you.
So you're talking about if I'm out at a restaurant, because they do overfeed us.
Yes,
Most
they sure do.
restaurants in America, they give you more than you need. So
yes.
you're saying if I'm a diabetic, cut it in half. Take half, and put the rest in a to-go box.
Sure.
Okay.
Yes, okay.
Good tip.
Carry your meds with you. Carry your insulin pen with you. That's very important. People forgetting that all the time. Preparing a healthy meals if you can, if you're home, or if you have a Airbnb.
Okay.
You can prepare your own meals.
Okay.
Take time for social activities, brisk walking or relaxation technique. Read a book. Knowing your numbers, that's very important for hypoglycemia and hyperglycemia. And treatment, what you need to do if you have low blood sugar.
Oh, yes.
That's important.
Good to know.
Yeah.
I had a situation where this is when I was first diagnosed, and I was in total denial. I did not want to accept it because, like I said, I had seen, with my dad, with my grandmother. My dad actually had macular degeneration. So he lost his eyesight due to it. But I had a situation where I really was not managing my numbers, and I ended up in the hospital with diabetic ketoacidosis. And that's very serious.
Very, very serious.
Yes. And that was like low blood sugars. Right?
No, high.
High. The numbers are high. Yes.
High.
Very high.
Very high
Okay.
blood sugars.
Yeah. So that's something you need to watch out for. What are some other things that you need other than that condition? Are there some other things like that diabetics should be aware of?
Well, yes. One of the things that diabetic patients should be aware of is they can have some joint issues. People with type 2 diabetes are more prone to joint problems such as gout, Charcot foot, carpal tunnel syndrome, trigger fingers, frozen shoulders, diabetic neuropathy in the feet and ankles, which can lead to swelling and deformity. Also, diabetes neuropathy can cause nerve damage, joint pain, and loss of sensation.
Now, wait, what was the second one that you talked about? I don't think I heard you said, can you go through the list again? So you said?
Type 2, people with type 2 are prone to joint problems.
Right.
Gout.
Okay.
Charcot foot.
What is that?
It's like a claw foot.
What?
Yes. Carpal tunnel syndrome, trigger fingers, frozen shoulder.
Okay. What's frozen shoulder like? What does that look like? Maybe I had that. I don't know. What does it feel like?
You'll be another pain. That's some nerve problem. No, you don't.
I don't want that.
Well, no, you don't. That's why it's very important to manage your type 2 diabetes as much as you can.
Okay, but these are some symptoms.
These are
like if you're experiencing some of these joint issues, you definitely want to call and get an appointment and see a provider. Okay.
Sure.
Do we have some providers here at NorthPoint that specialize, or would you just see a family practitioner?
A family practitioner.
Okay. All right. Wow.
If you need to be referred out, they'll refer you out.
Sure. All right. Michele, why is this work important to our community?
Our vision at NorthPoint Health and Wellness Center set a standard of excellence in providing cultural, responsive, integrated, holistic primary health and social services that strengthen our community and the lives of the people we serve. We have a higher risk in the community that we serve. For example, African American, Latino, Hmong, and African. Also, because of the community that we serve, it is why it is important to have a certified diabetes educator specialist on board so most people can live a healthier life with diabetes.
Wonderful. Thank you. So
I have a takeaway.
You have a takeaway, and that's where I'm going. You're keeping me on track with this. You're keeping me on track. I need you in my life, Michele. So yes, what would you have our listeners? Is there anything that you'd want to share with the folks listening out there?
Sure. No matter which type of diabetes you may have, the goal is to control your blood sugar by making lifestyle changes that will help improve your health. Studies have shown that appropriate use of self-monitoring blood sugar significantly improve glycemic management and facilitate more timely and aggressive treatment. that can change in non-insulin or type 2 diabetes without decreasing their well-being.
Okay, so that's the knowing your numbers part.
Knowing your
That's
number
like
parts.
very important.
Very important.
Okay, okay. And what about someone who's listening who maybe is feeling some neuropathy and, they're a little scared to come in? What would you say to them, Michele?
Well, it's important to come in because we do have a comprehensive foot exam. Just to make sure if you have any kind of sensation in your foot, we can check it. And then if you need to go back to your doctor to send you out to see a neurologist, so that's important to do as well.
Okay.
Because if don't feel scared to come, because that's what we specialize on. So we'll be able to help you and guide you to the best direction of what you need to do when you have type 2 diabetes.
Okay.
Okay.
Wonderful. And then are there currently any, or have we had before any kind of support? Are there, how can a family member support someone that's on a diabetic journey? Are there any resources or?
Well, before COVID, we used to have a monthly diabetic support group, but because of the COVID, we kind of have not restarted again.
Okay.
But we're working on some things.
Okay,
We're working on something, but I would really recommend it that everyone, if you have time, we can make time for you to come in and on Tuesdays or to schedule an appointment on Tuesdays and Thursdays for the diabetic self-management education program, because you'll see the dietitian, you'll see the nurse, and then also you'll see one of the providers, provider support. So it's 3 providers with 1 visit. So that's important.
Okay, and those are offered currently on Tuesdays and Thursdays. And so you would call in and you would say, okay.
Yep,
and do you need to already have a NorthPoint provider to
Yes,
be referred to that, correct? Okay, okay.
Or you can call me. I can always get a referral from the provider as well.
Okay, well, I'm going to make my
So I'm
phone
here.
call.
Please do.
I'm going to start as soon as this is over, I'm going
Please
to call
do.
in and say,
Yes, Michele.
right.
Karen.
Wonderful. Okay,
Yeah.
thank you so much for
Sweezy.
being
Yeah,
here.
thank you. Thank you so much
today.
for having me.
Yes.
It was
Well,
fun.
we want to thank all of you for listening to our NorthPoint Making Health Happen. We want you to know that we're here to partner with you in creating a healthier community.
Yes,
Yes.
definitely.
Thank you.
Thank you.
Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.